Uh, Good morning, respected chairs, professor, and dear colleagues. It's my great honor to speak at this International Keloid Symposium. Today, I will focus on innovative approach to treating Mandibular Keloid. The mid-part technique combined with post-operative radiotherapy and share with you based on clinical practice. Now, let's start my presentation. Our presentation is divided into 7 parts. We'll start an introduction to the problem, then explain the rationale behind our new approach. Our focus is on candida located on the mobile or journalized. This area is prone to candida formation due to high skin tension and frequent trauma from acne. Current treatment have limitations. No surgeries, options like serial injection often don't work well for several cases. Surgical excision alone will have a very high recurrence rate. More complex surgeries can create new scars. Our new approach is based on the POT technique, which is commonly used for biopsy and treating conditions like acne scars. Its advantages are its simplistic, minimal trauma to surround tissues, and fast healing. Our hypothesis was that a mid-part technique could treat candida by reducing tensions, which is a major cause of their formation. By creating a honeycomb patterns, we can release tensions, remove some scar tissues, and even provide drainage. We then combine with the radiotherapy to target any remaining abnormal cells and prevent recurrence. To test this approach, we conducted a retrospective study at the Third People's Hospital of Hangzhou between 2022 and 2024. We included 16 patients with Mandibular Keloid. Here is our step-by-step look at the mid-part technique. We use a 2 mm Trephine to patch hole down to the fat layers. Then we go back in at an angle to release the subcutaneous tissues, creating a honeycomb pattern. A critical point is to keep the hole at least 2 mm apart to avoid tissue death. After the procedures, apply a sterile dress and a modified elastic mask for pre-surface. This helps prevent hormonal formation, provide continued pressures, which is beneficial for healing. A key part of our treatment is advanced radiotherapies. Given within 24 hours of surgeries, we use an electro-linear accelerator to deliver a total dose of 20 degrees in 4 functions. Now let's look at our result. We treated 16 patients, most younger male with an average age 24.5 years. The average duration of their candidate was about 2 years. And we followed all patients for at least 1 year of treatment. To evaluate the result, we use both objective and subjective tools, the VAS PARS and PSA scores. Objectively, we saw a dramatic improvement. The average VSI score jumped from 9.31 before treatment to 3.81 after treatment, a highly significant reductions. As you can see from the chart, every single component of the score, corner redness, and highly improved significantly. From the patient's perspective, the result was equally impressive. The average PSA scores jumped from 18 to 7. Importantly, the treatment was very safe. We observed no major complications like excessive bleeding and infections. The wound healed well. Now, let's look at some case studies. This 28 years old female had a candidate on her right motorbike. We used combinations of excision and mini patch. As you can see, 2.5 years later, the result is excellent, with significant flattening and fat of the scar. The case 2, this 21 years old male also had a candidate on his motorbike. Again, we used a combination of excision and mini patch. After 1 year, the improvement is excellent. Case 3, this case shows the mini-patch technique used along for candidate. This 24 years old male had extensive scarring on his left motorbike. After 2 years, the result is excellent, proving that the mini-patch is active, even without surgical excision for certain type of scars. This case shows the mini-patch technique used along for candidate. This 24 years old male had extensive scar on his left motorbike. After 2 years, the result is excellent, provided that the mini-patch is effective even without surgical action for certain types of scar. This 26 years old male had a mix of raised flatter scar on his left motorbike. To address the different types of scar tissues, we use a tolerated combination of surgical technique. We performed direct surgical action for the larger, more permanent scars, and then mini-patch technique to refine the remaining flattening lesions. Finally, this 29 years old male had several candidates. Using our combined approach, we achieved an excellent outcome after 1 year. So, what makes this technique so advantageous? It effectively reduces tensions, which is crucial for preventing a recurrence. It provides normal preserve normal skins, is simple and safe to perform, and promotes faster healings. When used with excisions, it even helps the man would heal better by acting a drain. It is important to acknowledge the limitations of studies. It was a retrospective study with a relatively small sample size and no control group. Therefore, further research is needed, including low-term follow-up and positively contributed trials to fully validate our finding. In conclusions, our study shows that combining the mini-patch technique with post-operative radiotherapy is a reliable and effective. Without tensions, preserve hair, skin, and is simple to perform. We highly recommend this approach for the chronic scars. Based on our findings, we all the key clinical recommendations use the mini-patch for scarring, extensive scars, and excision for the large red ones. Technically, ensure your patch deep enough to and keep the hair at least 2 millimeters apart. And post-operatively apply priority press to prevent complication. For the future, we plan to conduct larger randomized control trial to confirm our result. We also want to investigate the optimal patch size and pattern for different scar type, and explore combining this technique with other therapy, like injection, for even better outcome. Thank you very much.